Today we're going to demonstrate a dependent or assisted slide board transfer going from a chair to a bed or a bed to a chair. This skill is used when a patient is not able to perform a regular push-up transfer, when they have enough strength to lift most of the weight off the buttocks, and when they have sufficient sitting balance to move in a sitting position. This transfer is completed by doing a series of push-ups, which are extension of the upper extremities accompanied by shoulder depression, allowing patients to lift their body. Also, the patient needs to slide sideways while performing each push-up. While completing the activity, the patient may place their palms flat on the sliding board, grasp the armrest or drive wheel of the wheelchair, or make a fist and place the outside of their fist on the wheel of the sliding board to achieve higher lift during push-ups. The patient must not grasp the edge of the sliding board because this places the distal ends of the fingers underneath the sliding board, where they can get pinched. The upper extremity on the side to which the patient will transfer must be placed slightly away from the patient so that they can have adequate room to move in that direction. A gait belt should be on the patient throughout the entire activity for safety, and depending on the patient's level of dependence, the therapist can either guide the patient by holding onto their shoulders as a contact guard, or the therapist can place their hands under the patient's buttocks to assist with lifting the body off of the slide board during push-up with more dependent patients. Okay, so we're going to place the patient's chair at a slight angle to the bed. Sometimes people do it parallel, but sometimes it's a little bit easier to do the transfer if it's at a slight angle. We're going to lock the wheelchair wheels so they're stable while they're doing this, and the patient can use the wheelchair as the bracing tool. We're going to take off the footrest, place the patient's feet down there, this one away. Yep. And then we also want to take away the armrest closest to the bed, so it doesn't get in the way of the transfer. We're going to have the patient first lean to the side away from the bed, place the slide board underneath one buttock, and then we're going to ask the patient, do you feel pinched between the board and the seat, or are you comfortable?
I'm comfortable.
Okay. So then two ways we can do this transfer are either with our hands on the patient's shoulders for guidance if the patient needs help with stability, or we can also place our hands underneath their buttocks so we can assist with their lift if they have no lower extremity strength or are having trouble completing push-ups. So what we're going to have them do is place their hand out to the side, twist their body away from the direction that they're doing push-ups, and then proceed to do the push-ups while guarding, and then continue doing the push-ups until you only have one buttock on the slide board. Then we're going to have them lean away from the chair, remove the slide board. Are you comfortable? Do you feel stable?
Yes.
Okay, then we can back away from the patient. Okay, now we're going to do a transfer from the bed to a chair, which is pretty much the same as the chair to a bed. Again, you want to make sure that the level of the bed is either the same as the chair or that the surface that you're going to is going to be lower. Right now we just have them level. So I'm going to have you lean away. And then for this demonstration, I'm going to pretend that Noelle needs more assistance, so she's dependent. So while she's doing the transfer, I'm going to have my hands underneath her buttocks, assisting her with lifting while she does each transfer. And now she'll be safely on the chair. We'll remove the slide board, and she is stable in the chair, so we're